but Dr. Liliana Oakes from UT Health Science Center, a geriatrician, is joining us today, and she's going to tell you about caring for yourself when caring for a loved one with dementia.
Good morning, everyone. This is an honor, a privilege to be with you this morning, and what I hope that we work together in the next 45 minutes is to try to pause for a second and think about yourselves and myself. I have a personal connection with dementia because when I was in my teenagers, I had a grandfather who I was very close to who developed dementia. And being Colombian, it was really a challenge in those days to understand the disease, to see how he was changing so much and disappearing from the person that I used to grow up with, and it's dear to my heart, the journey of being a family member, taking care of somebody with dementia. What I wanted to start with is understanding why we're spending this time together. And it's no news to you to know that dementia is a disorder that is really tragic. And it's tragic because we think that in dementia we lose them twice. One time when they are changing so much in their process and they disappear, who they are, their personality, their ability to communicate. And the second time we lose them when they die finally from this disease or another complication. So we need to remember that it's a very tragic disease, and it consumes a lot of resources, not only in the healthcare system, but emotionally it drains the person caring for them and their family. Most people survive between 6 to 8 years. That's what we call an average, meaning the majority of people from point of diagnosis to when they die, if they die from the disease, will live with this disease close to 10 years. I have known personal families that have walked this journey for 20 years. And there are other type of dementias that can unfortunately end the life of a person sooner, like frontotemporal dementias, where usually these patients last only 2 years. So again, it can become a long journey. It's not a little short run, it's a marathon. And when people that run or exercise, or you see the marathon runners, you need to prepare for the journey. Caregiving is usually experienced as a rewarding experience, despite of the stress and burden. And I think that that's very important for caregivers to know that despite of the challenges that happen, there is a sense of rewarding that we are doing what is the right thing to do. Even though we understand that sometimes as a duty, many of the caregivers will say, well, if I needed to do it, I will do it again because they were my parents, or this is my spouse, or even children. Some early dementias, we find parents taking care of younger children that are in their 50s that develop this horrendous disease. There are a lot of challenges, and the challenges are related with what I already mentioned, the losses and the accumulation of changes. And because the disease we will review today has many stages, and they change over time, and the caregivers and the family need to adapt to those changes, it's very challenging. We see a lot of in our families that what they were able to do in the earliest stages and try to maintain the dignity and the person involved in activities, suddenly with the decline in the disease, they cannot do it anymore, and that produces stress and anxiety in the family and the caregivers. The other key point is we're going to be reviewing today the amount of the skills that are needed to take care with somebody with dementia. And I hear my caregiver saying, Dr. Oakes, I love my mom, but love is not enough. Part of what we wanted to do with the series and Morningside Ministries and mmlearn.org is that you get equipped with a toolbox of strategies, ideas, and having work with other caregivers can empower you to have different strategies, because this long process and disease is going to require that you use different ones in different stages. So you can love your loved one with dementia, but if you are not equipped, you are not going to be able to take care of yourself and provide the best care for your loved one. So let us talk a little bit about the impact in caregiving. 80% of the care to older people with dementia are done by family. And what that means is that there is what we call informal caregiving, meaning it's unpaid, and it's costing between $150 to $175 billion per year. So there is a lot of situations where maybe you are hearing today or you are watching this production and saying, wow, I didn't realize this is so expensive. And everybody does it, but the impact economically in the system is huge. So the experiences of the caregivers are, I was listed in the slide, a variety of emotion. There is a sense of loss, emotional stress. There is much more healthcare problems in the caregivers. We know that up to 60% to 80% of caregivers at some point can develop anxiety, depression. Have you been there? Think about yourself. How are you feeling so many times when you needed to quit your job? Probably because nobody else could care of mom or dad or your sibling or a child with this disease, and then there is less income, and maybe with the economy, many children are coming back home, and then now you have an extended family that you didn't expect. So there is a lot of adjustments around this disease due to multiple reasons. There are decreased work hours, the lower wages. We, in my office, I sign a lot of family leave paperwork related with, well, mom is now getting sicker, she has dementia, I need to take her to the doctor, or they get hospitalized, I need to go to the hospital or the nursing home, and then suddenly they cannot work. So the impact economically is related with all of these issues. There is also loss of full-time work and the benefits including with that. So many caregivers are really stressed out because the economics of caring with somebody with dementia. And I think the point here is now that we're transforming our health care, we need to look about ways to improve and support caregivers and find some common sense in how we're going to be economically taking care of each other, because the challenges are going to increase, not decrease. What are the benefits of having the family involved in the care of somebody with dementia? Definitely, we see that when families are involved in a patient with dementia, they don't end up in a nursing home. They stay longer in the house, especially when you have more children participating in the care or other providers or caregivers. And we're talking about caregiver as anyone that is providing direct personal care to somebody with dementia. So not necessarily I'm talking today about you as a Connect Blood family member, but it could be a provider paid by the state. It could be a provider that you are paying through a community-based organization to provide care. So caregiver it's a big word. So I'm talking today about you. If you are not related by blood with this person, but you are providing, bathing, changing, helping them the appointments, staying with them at home, even doing house chores. If you are paid by doing that, you are under the category of a caregiver. I wanted to clarify also that even though families are wonderful and it's the best scenario to care for older adults, sometimes it does not prevent to end up in a nursing home. And this is very important, especially for minority groups. We will do the same broadcast in Spanish later on that will be available for you. If you have family members of somebody that needs Spanish to talk about this issue, I will be doing it later on. But sometimes we have a lot of guilty feelings. I don't want mom or dad to be at the nursing home. I make the promise. Today I wanted that you reflect a little bit about try to stay away from promises. Do your best. I know in my heart as a physician when I encounter families, everybody loves mom or dad. Everybody wants them to stay home. But there are circumstances that you cannot foresee them, and will make you make decisions to place them because it's the right thing to do. A family with multiple little children or teenagers and children, a lot of economic issues at home, the elderly person with dementia is fighting a lot, is very confused, there is no peace in the house. This family maybe need to look in an option to place them in the best nursing home they can afford or they can place their loved one. So promises, think about yourself. Where are you in that journey? And especially Latino community, we really tend to make a lot of promises that later on backfire to us, and in the guilty feeling that we need to work together, and the physician in collaboration sometimes with psychologists is in a huge impact. So again, family is the ideal scenario for this multi-generational families that we wanted to encourage to have, because we find that there is a lot of benefits to having patients with dementia around their family and other children in different stages. But placement sometimes is the best thing to do. So I tell my families, never say never, because maybe you will need to walk through that journey at some point. I also wanted to tell you that even though if you place also your loved one, the stress doesn't go away. It just have a different face. It's like a cube. So the stress just changes the color. When we have one of those cubes that you change colors and organize, it just has a different face to it. And caregivers have a lot of stress and guilt feelings related with placement. And part of what we need to do is, it takes a whole village to work around those issues and to make you feel better, and you can continue being involved even though they are in the nursing home and trying to work things through that. So who makes up the caregivers? I know today we're going to be seeing men and women watching this broadcast, and what I wanted to tell you is 50 to 75% are women. Usually are related, they are the spouses, the daughters-in-law that have the most, care one-to-one. But don't look in the other 30 to 40% that are also men. And we see more and more that men are becoming more caregivers. And that is wonderful, but it also poses some challenges, especially when the sons are the ones caring for their mom. And there is a lot of issues about privacy, intimacy, and the care of personal care that is very challenging when you are the son and you are dealing with the female needs of a spouse, or you are dealing with the intimacy or personal care of your mom. So we need to balance those issues, and you need to be equipped, and you need to surround yourself by other resources that can help you to address these issues that are real and vital in the care of that loved one. The majority of the caregivers usually are married, they are employed outside the home, and they are caring usually for both parents and their own children. That's what you hear very often called the sandwich generation. You're raising your children and you're taking care of your parents, and more we're seeing that in the world. This is not a problem only for United States. Aging population is changing the statistics around the world, and more these issues are common all over the planet. So what I was mentioning before is I wanted to make sure that we understand this as caregivers. We're going to be facing our own challenges in terms of healthcare problems. The fact that we're going to be caring for somebody with dementia is going to put you in a high risk of depression and anxiety. 6 times higher than a person that is your same age, your same sex, maybe same socioeconomic status, but they don't care for somebody with dementia. So you need to be in the guard. You need to be aware that you maybe are going to develop these symptoms, and don't dismiss them or disregard them, which is what I wanted that you pause for a second today and see. Do you find yourself fighting for little things? Are you lacking sleep? Do you wake up at night thinking and ruminating thoughts, thinking over and over about worry stuff? Do you don't want it to go out? Are you withdrawing your hobbies? You are not enjoying things that you used to enjoy before. You just don't care. Is your energy level very low? If any of those are yes, 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 and you today, right now, you are thinking, wow, I have a lot of those, you are developing some component of depression and anxiety. And I understand, especially, again, many minority groups, you don't want it to recognize that. You feel it's a stigma. I'm caring for my mom, so why I'm feeling depressed? I should be very happy. It's normal to develop these feelings because your role has changed. You didn't expect that this happen. You probably thought, mom and dad raised me and now I am becoming the parent. I am the one doing the care. And you feel it's unjust. All of those thoughts are normal part of your process of thinking and readjusting. So what I'm inviting you today is be aware that if you are developing these symptoms, this is part of the normal process of the caregiving, and we're going to talk later, we need to address them. You need to talk them out, and you need to seek for medical help. Sometimes we just need to talk about it. We need a support group. Sometimes we need to rethink how we are managing our anger and getting equipped to deal with that. But sometimes we need medication. And today, from the bottom of my heart, medications are okay when they are needed. You shouldn't be afraid of opening and expand your mind to know that if that's what you need to go and partner with your physician, and that will make you a better caregiver and a better partner and a better spouse, maybe you need to be on those. You also, as a caregiver, need to know that physically, due to the high levels of chemicals that we call adrenaline in your stress, you're going to be a higher risk for heart problems. Usually double than in people that, are counterparts that don't care for people with dementia. Especially those cardiovascular risk factors are related with how long you are providing caregiving. So if you do caregiving over 9 hours a day, you are going to be flying constantly in high levels of anxiety, and that will affect your heart. Which reminds us that we are not only physical well-beings. We have our spiritual realm, we have our mind, our emotions, we have our relationships, and we cannot separate. And in this culture, unfortunately, we tend to fragment who we are. Here is what I do at home, these are my feelings, these are my emotions, my spirituality. Today, I wanted that we think that we are completely in a balance, and when one of those areas is out of balance, you are going to develop more anxiety, more depression, more anger. So how we recognize where we're feeling dry. So imagine a full glass, and unless a glass is full that can give and the water comes out of the glass, and you are feeling very dry and empty, you are not going to be able to give peace, love, caring, compassion when you yourself are feeling you are not getting any of those. So maybe you need to fill your cup and your spirituality and your own sense of who you are and your sense of well-being, your sense of what I'm doing here, your purpose, your relationship with God, with a transcendent being, with your sense of your value as a person. Maybe you need more time and your glass is empty because you have left behind everything you enjoy. So you need to work in that cup and how to provide, and we later on are going to talk about a few strategies to address that. Another major problem that I see is the caregivers don't go and get their preventive health. They don't get their immunizations, they don't get their screening tests, and that's a challenge because when we don't prevent, then we go to the disease process and it can be too late. So I see people that said, doctor, this is my first visit, I'm 75 years old, my mom just died at the age of 95, and I haven't been in the doctor for 5 years. That is something that I know is in the back of her mind. I'm feeling well, so I will do it tomorrow, versus being proactive, which is one of the pearls today. Let us be proactive. Take care of those vaccinations. Be sure you are getting your health maintenance. Be sure you are talking regularly with your doctor. Your cholesterol is under control. That you are not having tiredness because maybe you didn't check your thyroid disease and you are exhausted, not only for the caregiving piece, but maybe you are sick. Maybe you have something physically that maybe you are developing, God forbid, but the beginning of a cancer or a disease that is in the autoimmune system or immunological system. So we need to go to the doctor, and we see that. Caregivers usually are mom first, dad first, or my spouse first, and they neglect themselves. There is an increased use of acute medical services. So you work based on emergencies. So you only go when you are very sick with your allergies, or you only go if you have severe back pain, you take the pill, you get better. The mode is to fix and put a little bit of a cover in a major problem. So again, all of those things is, if you read today those of health consequences, and today you're thinking, wow, I'm at risk of getting worse, maybe it's time that you start taking notes today, paralleling your papers, and said, maybe I need to see the doctor. Have you seen the doctor at least once a year? If the answer is no, maybe that's one thing that you can do today. Pick up the phone after today and go and visit the doctor and get your annual check. Ask a neighbor, the church friends, or somebody, a family member, to care for your loved one while you invest a couple of hours in yourself, just to avoid the bad consequences of in your health of caregiving. So those are the health problems. Look at the emotional. It's a very special kind of loss, because one of the biggest things is when your loved one has been in this disease for so long, and then they don't remember your name. That's one of the most difficult and painful things you can experience as a caregiver, when your spouse confuses you as the wife with the daughter, or the daughter with the spouse, or they don't know who you are. They smile at you, but they don't know who you are. It's a very slow, it's a degenerative disease, so the amount of loss that is involved in caregiving is huge. A lot of fears of the future. What I'm going to do if, what happened when this happened? What if here? What if there? There is a lot of social isolation. Well, I cannot go and play bridge anymore, or I need to take care of him. Or I cannot go to the doctor. I cannot visit with my friends. We don't go anymore traveling. I hear a lot of, we don't go anymore to the family reunion. This is my last trip. This is there is a lot of changes in social isolation, and if you happen to have a loved one that has very difficult behaviors, like screaming, yelling, anxiety, they shadow you everywhere, those behaviors can be very difficult to handle in public. So the caregiver decided to just keep them at home, and imagine how you feel. Your sense of who you are and what you did is now confined to your home. So we reviewed that, withdraw from friends, activities, and a stigma. Oh, well, we're not going to invite them. You know, bless her heart, she's dealing with the spouse. Let us don't do any more birthdays, or let us don't invite her for these events. So it's hard to handle those, and in the Latino community remain a big stigma to be diagnosed with dementia, because it's misunderstood as a mental illness, while dementia is an organic disease. It's something that damages your brain. The same way that the heart gets damaged with heart failure, or the kidneys shut down, dementia is a disease, it's not a mental illness. It destroys your ability to function. So I want that you think about also the challenges with your own family or your family members. Think about, have you had any problems with your siblings or family members or relatives about caring for your loved one? Think about that for a second. In my practice, sometimes I hear, I saw a lady that is 80 years old, have long-term consumption of alcohol, develop a complex mix of dementias, and she's now bed-bound, wheelchair-bound. The family came one daughter, and she said, I have 12 more siblings. And my siblings don't understand what's wrong with my mom. They're going to think that she's going to get up tomorrow and you are going to prescribe a medication and she's going to be fine. How am I going to handle my 12 siblings? Are you in that category? Or the opposite, you don't have a lot of support. You have a large family, but everybody is very busy. They call very random, and you're by yourself making decisions. Or you have an angry family where somebody disappeared for 20 years and now the little brother is showing up because mom has some assets or economic things that need to be handled, and he now wants to come and be the decision maker, and he never has been close to the family. Or you are in the gray category where the 4 siblings are in agreement, they help each other, The one that lives far away in another state supports with money because he cannot be here or she cannot be here, and you are blessed to have the economic resources, but now you are sharing the care with your other people. You have maybe a family, a church family that is wonderful, and the church members that grow with you for the past 25 years are now helping you. So good or bad, there is always challenges among the community and our own family members. So what we need to understand is this disease is a community disease. It's a family affair. It's everybody involved, and it impacts everyone. There are new roles. There are conflicting responsibilities. So you go to your mom, dad, or a loved one goes, they get hospitalized, and then the doctors are doing a family meeting with you and saying, she cannot be by herself anymore. And then all your life crumbles apart, and you're hearing, what I'm going to do? Who is going to care for mom? So do we have the resources? Or, oh, no, she's fine. I think the doctors are wrong, right? The denial is common. It can't be that bad. She was living by herself. I saw another dear patient came from out of town, San Antonio, and the nieces, she never married, have kids, brought her, and she was living 6 months ago with her frail husband, and it took one fall. She got pneumonia, got extremely confused, developed what we call delirium, which is an acute change in confusional stage, but nobody knew they were demented. And then she went to get rehabilitation, broke her hip because she was very agitated. And now in 6 months, the life has changed completely, not only for her, but for her husband and her niece and nephew. And we did the best that we could to talk about goals of care, what to expect, how to prepare. The adult children may often minimize the problems. What we were talking about, you know, if you are not very involved, you live far away, they sound really good on the phone. I wanted that you pay attention here. Many people with dementia sound really good on the phone, sound really good when you are dealing with them for 5 minutes, but they cannot pay finances, they cannot drive anymore. So let us don't get fooled. I think part of what I want in this slide is the challenges are inviting your social support around, your family, friends, your community, to read about dementia, to talk about this disease. You can become an educator. As a caregiver, something that can give you a sense of accomplishment is educate others. And that's what we do in our businesses, equip the caregivers to go and educate their own family members, and also bring them back to a family meeting if it's necessary with the physician, so we can educate them. We will later on talk about the Alzheimer's Association in detail, locally, wherever you are, because they do a fabulous job helping you to navigate the challenges with your family members, with the person that is in denial, with the person that thinks that things are not that bad. They can help you as experts to navigate this journey, so you are not alone today. And at the end, there are more resources to come. We talk about the long-distance caregivers. I have done at the hospital family meetings with 2 children in the East Coast, 1 in the West Coast, and 3 in the room. Because everybody needs to hear sometimes where we are, what to expect, and start making decisions, which is the hardest part. A lot of old issues in the past. I think that's something that we help families and we encourage to clean, navigate, and heal. Well, is my brother really never help, or so-and-so was the abuser in the house, or dad used to mistreat mom. It's the time to heal the spiritual component of the caregiver. Many of the caregivers were severely abused by their parents, and now they are caring for them. We need to talk about that. We need to equip you and help you to heal if you are going to be the caregiver. Otherwise, you're going to be miserable, and you can provide poor care because your anger, your unforgiveness. So again, I'm talking a lot about healing, not only physically, emotionally, but spiritually. There is a huge component that we cannot ignore in caregiving process. This slide is just to tell you how hard it is for a spouse. If you today are the husband or the wife of a person with dementia, there is a tremendous loss. People that have been married for 30, 40, 50 years. I have had people married for 68 years. I have had the blessing to be a physician on couples that have been together so long. And then suddenly, that person is not there, not the person that they married. It's a different person. It's a person that now the changing the roles is requiring a lot of care. The person that used to take care of you or make you feel good now is behaving like a child and you are providing all the care. That's a big loss. And this is from L. Jones in Florida in Generations Alzheimer's, and it says for the ones in the teleconference that are not connected in the internet, I want my husband back. I need him more than ever now, but he's gone. I can go to him for advice. I can go to him for emotional support. He's just like a child. He's egocentric. He can comprehend my feelings. Cannot remember what I've been doing. I want someone to hold me and ease my fears like he used to. But he doesn't seem to get it anymore. My heart is with you because that exhortation from these women is speaking probably from many of yours today. Get those feelings out. Those are normal feelings. There is a sense of loss, but you are not alone. We're hearing to you. There are a lot of people like you in this journey. So how we can treasure the little moments together, and that's what we're going to be reviewing. Can you treasure the company, the watching the movie, even though he's not meeting all your needs, continue having the closeness, the collaboration, the companionship. The good memories. Maybe it's a time to open an album of your pictures when you get married. Many of our patients with Alzheimer's dementia, their long-term memory is preserved. They will enjoy looking at themselves when they were younger. And the military service, raising your kids. Treasure the memory that can give a sense to you now that you are losing that. Can give you a sense of recovery, a sense of peace. The physical intimacy, the holding hands, the snuggling in bed at night. We're not talking about sex here. We're talking about the love and the physical sense of being together. Because that's another thing that changes too, and is a very important loss for many older adults. The support, the caring for each other. I am here, even if I'm not talking a lot. The dreams for the future, adapting to the future, they are lost. So what are we doing day by day? Sometimes these journeys is not dreaming about, not even what is this going to happen this afternoon, because you just survived the morning breakfast. And the dealing with the loss alone is a big sense of, again, reaching out to your kids, other women or men that are in your situation, talking this out, praying about that. Complaining to God. That's okay. That there is nothing wrong to talk to Him and complain about this. I wanted to just talk about a definition. If you are, many people said, Dr. Oaks, my mom has Alzheimer's, but she doesn't have dementia. Or the opposite. She has dementia, but the Alzheimer's is not there. I wanted to clarify that concept because you are probably asking yourself that question. What is dementia? So dementia is a broad general category that talks about an acquired global decline. Global means not only the memory, but people with dementia will lose the ability to make decisions, the ability to speak or use appropriate words, the ability to do mathematical thinking, the ability to have reasoning, the ability to understand abstract concepts or things from something that happened to understand the complexity of a situation. So many of the areas of the factory of the brain, if you imagine that the brain has multiple areas, one is the memory, the perception, the reasoning, the language, the logical thinking, the mathematical thinking, all that factory start having problems in each one of those individual areas to the point that that person is not able to do what you do every day, getting up, planning what you need to do, paying your bills, you need to go to the grocery store, you need to drive, you need to take care of the kids, you need to think what clothes you're going to wear, what. They cannot do anything because their factory has shut down. So it's a global problem that interferes with their function. So many of you probably misplace your glasses or your keys, right? Any of you maybe go to the refrigerator and you're like, what I'm here for? Those are normal memory losses that are related with lack of attention. We call those executive function memory problems. They are no dementia. Dementia is when all of those come together and you can not cook anymore. You cannot use the phone. You cannot drive anymore. You cannot pay your finances when your functional level is so impersonal. Don't worry. Maybe the depression or anxiety is making you misplace things and be a little bit disorganized, or you find yourself wonder too much. Maybe are no signs of dementia. In dementia, imagine for the ones in the teleconference, it's like when you hear the word cancer, it's a big umbrella. There is a big word. So dementia is the big word to talk about that global decline. But, you know, when you hear the word cancer, you think there is breast cancer, colon cancer, pancreatic cancer, ear cancer. The same way with dementia. Dementia is the big word. And the most common dementia, let's see if I find this, is the Alzheimer's disease. So for that blue big piece that you have here, the purple one, around 60% of the most common dementia, imagine the umbrella again, is Alzheimer's disease. But there are other dementia illnesses that are common, vascular causes, meaning the people that don't have good blood flow, they have a little bit various strokes, those are called vascular causes. People that have damage in the front of the brain, called frontotemporal dementia, is a dementia that starts very early with behavioral problems, screaming, yelling. You didn't have a prior memory loss, that suddenly they have sexual disinhibition, frontotemporal dementia. People with Parkinson's, they can develop what we call Lewy body dementia or Parkinson's dementia. That's around 10%. And there is a group around 12% from 100 people that you will say they have dementia, where 12 potentially have something that is reversible. Bad thyroid problem, bad vitamin deficiency, B12, problems with alcohol, renal, it potentially can make a difference here. But again, the most common type of dementia, which is the big word, is Alzheimer's. There are close to 100 dementia type of illness. Okay, let me see here. Go back here. Briefly, just to say that the most important thing to relieve some of your depression and anxiety is get the right diagnosis. Remember the pie that I showed you? One of the things that is very important is if you're suspecting that your loved one doesn't have the right diagnosis, you need to get them diagnosed. Why? It helps you as a caregiver to decrease your anxiety level. If they have the right diagnosis, you are going to be able to plan for the future. What are your goals of care? Is the problem with the memory? Is the problem that they are wandering around? Is the problem that they are very agitated? Is the problem that they are not sleeping? But you have the right diagnosis. And if you have the right diagnosis, there are definitely medications that could slow down the progression. Dementia at this point is an incurable disease. We're looking for and searching. I hope in the next 5 to 10 years we will have a cure. But in the meantime, we do not have a lot of therapy that can help. So it's a lot of into what can we do in the environment and the caregiving to improve the care and maintain the dignity of the patients with dementia. So if you have a good doctor, start with your primary care doctor. But many of the doctors in 5-10 minute visits cannot do this. So if you are thinking that your loved one is having problems with their memory, their ability to function, they are more confused, they have been getting lost, maybe it's a time to look into a specialist. If you want a physician, look into the internet or go to the Alzheimer's Association. They will help you to locate an expert that can give you a true diagnosis. Be ready for those visits. What diagnosis they have, bring the medications, consider participating in studies if that's what you want to do. We talk about the most common dementia. I wanted to point out to this chart here because part of the caregiver stressors are related when you start in the mild process where the symptoms are starting. Usually the caregiver handles those very well. Prompting, cueing, reminding, redirecting. The major problems in Alzheimer's dementia is later on around 4 to the 5 year period where the loved one can develop behavioral problems. Those are one of the most difficult periods is when they start being agitated because they're more confused. So again, because it's a disease that progresses, your caregiving toolbox to manage them needs to change because there are going to be challenges across the board that are going to be difficult for you. So I'm going to review briefly the stages. People talk about 7 stages. I make it simple. You have early stage, moderate, severe, and terminal. If you're an early stage, usually in the first 2 to 4 years, there is some mild confusion about time or place, little bit of personality changes, a little bit of anxiety. They withdraw more because they get confused and they prefer to keep the things easy. So a little bit of withdrawing there. Some poor decision making, so that's when they write the check over the money they need to pay. Then you move to the more difficult stages, the moderate, where they are a little bit more confused. And they are more restless, they need a lot of repetition, more problems with their language. They don't understand the environment. So if they go for vacation and they are used to go to the bathroom that is on the right, and now in the hotel the bathroom is on the left, they have incontinence issues. They will get agitated with the food if it's not what they are used to eat. There are problems with the way that they see. I see a lot of people watching novelas and having serious problems misinterpreting the novela because they don't know anymore that's no reality. People looking at, recently a lady came with a beautiful gown, Chinese style, and red with stripes. She has delusions and she thought somebody was beating her up and that was blood. The misperception of something that for you and me is normal become a challenge on them. In later stages, they don't recognize the family, cannot express correctly with their language, difficulty eating, and if they live long enough, they lose the ability to feed themselves. So very important to maintain them. If you can take care of them and meet their needs, simultaneously your anxiety can decrease. So maintain and optimize the physical health and the nutrition and activity. Same routine, same environment. So you also have a plan. Today we get up, it's breakfast, then we do the walk, we do a little bit of the gardening, we maybe need to fold towels in the afternoon, little nap, go to bed. You need to develop what I'm doing that keeps the routine the same, easy going. Provide interesting environment, social interaction, watching the pictures when you got married, or if the person likes wood pieces or puzzles, maybe simple puzzles that they can do can help you. Maybe the daycare is something that you need to consider that will give you 2 to 4 hours a day so you could take care of yourself. Encourage independence with modifications. You can let them make the coffee if you're next to them and you walk together how you do the coffee process. Something so easy for somebody with dementia that is getting worse can become really hard. They can put the water and they can run it without putting the coffee. But if you are there and tell them you forgot to put the calendar, you need to put the coffee, it's something that can maintain the activity. So be creative. Address the loss of initiative by structuring the day. We talk about that. The Alzheimer's Association has a list of 101 things you can do with your loved one with dementia. You can pick up every day a couple of simple things that can help you there. I wanted to mention that expectations. This is a hard one. This can take a whole talk, but if you weren't the perfect spouse before, it is unrealistic that now you're going to be perfect. Know that. You know, you are an imperfect person, so don't expect that now because there are, more demented, now suddenly you're going to become a saint. So we really need to be mindful about how we see ourselves. So these are the tips to communicate effectively that can help you to probably decrease your anxiety level. Reassure, redirect, be alert to the feelings. La importancia de recordar, the reminiscence piece. Go on the past, what is important for them. Repetition, short sentences. Don't explain big things. Don't ask them to do things that they cannot do because you are going to be mad. Don't try to quiz them. They cannot answer you. They cannot process the information, so don't quiz them over and over. Don't try to argue. Identify yourself. If they don't recognize you, I know it's really hard, but tell them who you are. Mami, soy yo. Mom, I am your daughter. I'm Liliana. Validate the feelings. I'm sorry you're feeling sad today, or I'm sorry you're feeling tired. Do not speak around them. Involve them in the conversation. Ask them for simple opinions. Do you like my blouse? Do you like the chocolate this morning? Do you like the coffee? Give directions one step at a time. Show them, mimic the action. Express your love. Compliment when you can. Remember that in communication, 55% of what you said is not the words that you use. It's how you say things. So your verbal language. Are you angry? Are you asking them to eat, but are you tense? Are you looking at them mad? They are going to sense more than that saying, just eat your breakfast. So again, go to the mirror. You're having a hard time? Don't argue. Go look yourself in the mirror and look at yourself and change the way that you're looking. Put those shoulders down. Take a deep breath. I'm telling you, it's better than you go and isolate yourself for 2 minutes than staying in the same situation until you get into a struggle or physical abuse that I have seen in patients with dementia and their caregivers. Retrieve. Breathe deeply. Change your environment. Maintain a safe and comfortable interior. Try to keep about the noise. If they're hearing too many things at once, they're going to be agitated, and the agitation makes you more anxious. So think about how, are they cold? Are they warm? Are they in pain? Are they having the appropriate shoes? And this is a cycle that shows in the slide how caregiving immediately, you start with love and sincere desire to take care of them. Then you develop fatigue. Then you develop anxiety and resentment around the fatigue. And then you remember that it's not their fault, so you develop feelings of guilt. And then if you don't relieve or intervene in this cycle, you're going to go all over again. So we need to break the cycle by, again, equipping you, taking care of yourself, understanding the disease, getting into the support group. What helps behavioral problems? Usually don't assume that we have problems related with, because it's dementia. It could be that they're sick. So talk to your doctor, modify the environment. I wanted to talk to you about questions that you can ask yourself. Are you getting outside? Are you getting enough sunlight? Are you eating well? Drinking, eating? Are you having a spiritual nourishment? Are you getting physical and dental care? Do you make time for your friends? Are you doing things that you enjoy? Are you sleeping okay? Do you make time for quiet and solitude? If any of those are no, or many of them are no, I will invite you to start working in each one of them. At least 2 a day. Be proactive in the next 2 weeks to approach and start making changes around that. Remember that not everyone can help you. Don't expect that there are people that are not suited to take care of people with dementia for multiple reasons. So again, expectation. I have left some other resources about driving that you can look in the broadcast. Prepare your legal issues when they are not that demented. Talk about advanced directives. If you don't know what an advanced directive is, please talk to your doctor. It will save you a big headache. It will help you to minimize stress when they are sick, not only economically but medically. These are readings that are in the broadcast, so if you are in the teleconference, please go to the resources, but the Alzheimer's Association is the best resource I can tell you to give you more resources. There is a great book about Coach Broyle's Playbook for Alzheimer's Caregiver, which is a practical tips guide, is offered through the Alzheimer's Association, the 36-hour day, and other resources. I wanted to close with this statement from Frank Broyles. My best advice to you is to treasure each day and live it to the fullest. Cherish the time you spend together and, perhaps more important, love each other. I hope you find peace in knowing that it is still possible to live and love when someone you love is living with Alzheimer's. I wanted to acknowledge Dr. Karen Blanc, who appreciates some of the slide materials I have used today, and Melissa Talamantes, who works with me. And moving now for the question session, from Pam, how I can handle my lack of sleep. Should I take meds? I'm afraid I won't be alert for my loved one. Okay, I'm going to try to answer that. That's a complex question, but there are a few tips. Are you having lack of sleep because you're anxious? Are you depressed? Are you maybe not taking too much caffeine, alcohol at night? Are you exercising too late? What is making you having the sleep problem? The other problem is, are you having problems starting to sleep, or you fall asleep well and then you wake up? If the problem is related, oh my goodness, maybe I miss my loved one, get a baby monitor. Put them in a low bed at night. Be sure that they're safe. Be sure that the light has lights on. So if they get up, they will know where they're walking around. And you can put the baby monitor. You can buy those in any place in the city. Walmart, Babies R Us, you choose it. You can hear when they're moving. Be sure that they are not waking up at night a lot because they are sick or hungry. Because if they can sleep better, talk to the doctor, then you can sleep better. So again, finding out why the lack of sleep is in your loved one, do the monitor, do safety placing things. Please be sure you have the doors locked. So if they say you are exhausted and they get up and they try to wander, they're not going to be leaving the house. From Judith, how do I get to doctor if there is no one to help care for my husband? Is there a way to bring my husband to the clinic? So the question is, again, I don't know the details. Many of my patients come with their loved ones with dementia. Not a problem. If they are with you, be sure you bring them snacks. You bring them a little puzzle book or something that they like to do. And if they don't have behavioral problems, absolutely. You won't realize, but asking a neighbor to help you, a friend from church, a family member in advance said, in 2 months I have my doctor's visit. If you tell your family that they need to be taken care while you do your doctor's appointment, people like to help you that way. So if you don't have anybody, bring them with you if they don't have behavioral issues. If they are a little bit nervous, you, Judith, can call the doctor and say, I want my appointments at the end. So you don't need to wait in the waiting office for 2 hours with your spouse, but you can be seen at the end of the day, so there are less patients waiting and you can be more comfortable. You can also ask the nurse, can I go with my husband to one of your empty rooms if he's getting agitated? Walk them in the office. So again, it's a matter to be creative. Great question so far. From John, how late in the disease, meaning dementia, should I get my wife's vision checked? So if your wife is able to verbalize and answer and be curable about how she sees, probably in the earliest stages, they can tell you if they can see well or not. When they're moving to the moderate or the advanced stage, they don't cooperate. They don't understand why you are putting them through all of those visual aids. They get agitated because they need to put those on top of their head. So listen to the cues. Your wife is going to tell you, I am very confused, I don't like this, why you're bringing me. Maybe at that point, you just need to focus into just use the glasses that you have, maybe finding some loops or any glass that can augment the writing. Again, what is the goal of care? Do you want her just walking and be safe, or you want her reading? If you like her reading, maybe no more time for reading. Buy her tapes so she can listen to the books aloud. From Rhonda Rhodes, it is very hard trying to deal with repeating myself day after day on the same issues with dealing with mother. How do others deal with this? I will love that you will post in our blog strategies that you have used, and I'm going to ask the mmlearn.org to see if that's possible, because in my experience, I can tell you a few things. One of those is depends what they are asking you to repeat. So if it's, I will give you an example. I wanted to go back to El Paso. I'm now in San Antonio. I wanted to go to El Paso. Why you don't take me to El Paso 10 times a day? I finally told the caregiver, tell her you're going to take her very soon. Don't explain anymore why you needed to bring her here from El Paso because she was having problems. She was spending like 20 minutes 10 times a day explaining the same thing. So she started telling her mom, Mommy, that's a great idea. We're going to plan the trip tomorrow. And she immediately answered, oh, okay, thank you. And the 20 minutes went away. She didn't need to explain anymore. So sometimes we think that they are asking something because they want an answer. Sometimes we just need to redirect them. You know, like we are going to, I'm sorry, I just got the cue that I need to move to the camera, so I apologize. So another thing will be you put, if they don't know where things are, put signs. Refrigerator, sofa, lunch. And again, I don't know the particular what you need to repeat so much. So having a lot of cues, written things, just don't argue but redirect them. Oh, that's a great idea, but why we don't come and do this? And again, if you want, you can email me specifically what you need to repeat, and we maybe can give you more specific ideas, but those are things that we try to encourage caregivers to do. From Marie, my grandmother lives with me, and it is sometimes very stressful. Your slide talks about an increase for cardiovascular disease. How do I make sure that I know the symptoms, or how to prevent symptoms? Because my role is not changing. Great question. Go to the doctor. You need to be checked. If you are a diabetic, do you smoke, you drink alcohol, you are obese, your cholesterol is high, you are at high risk. If you don't have any of those, but you are definitely providing more than 9 hours a day and you are very stressed out, maybe it's just talking to the doctor about relieving your stress, exercising, sleeping more. So again, it depends on your cardiovascular risk factors. What other diseases do you have? If you're having continuous chest pain, even with minor exertion, and you feel short of breath, and you maybe need to go right away. So again, chest pain that doesn't relieve for 30 minutes, don't think that is acid reflux. You need to take care of yourself and go to the doctor. Somebody is asking us, I have many employees who need to leave work frequently for their parents with dementia. Are their absences covered under FMLA? Yes, sir. I do. I cover those under FMLA, and I fill up. You need to talk to that employee of yours, and they can bring that to their doctor that care for the mom, and the physicians, we sign those, but they're covered. You need to know that in countries like Japan, they are developing daycare centers on top of their buildings where the employees can bring their parents, and they can leave them where they work. And I think that that's one of the things that we need to start thinking around this country. Do we need to start developing in high corporations not only places for our employees to exercise, but do we need to develop a daycare center for older adults, not only for children? From Juanita, the only problem that really causes stress for me is that my grandmother follows me around every moment. How do I deal with that? So I was talking early on the shadowing. They shadow you everywhere. Usually it's related with anxiety, lack of routine and activity. They are very anxious, and you are the only person that reassures them. So multiple things. One, keep the routine simple, but do routines. Even if you need to change them every 10, 15 minutes, if you get the 101 activities for the Alzheimer's, Alzheimer's Association, you will be able to make a schedule where she can be more occupied. Reassure her, love her, hug her, have more pictures of you and her around. Don't change the routine constantly. And if the shadowing is severe, sometimes it could be that they are in pain, they may be hungry, and they don't know how to express that. So again, look into the slides about the environment and the things that you need to do. And we maybe do a whole broadcast about just behavioral management. So keep tuned, because you maybe can get more tips on that. Take her to the doctor to rule out other things. I need to give now Maria the chance to finish the program. It has been a privilege to work with you, and glad to be helpful in that you opened your home for me today. Thank you.